Is this painful here?
Yeah, when you push on it, it is.
Okay, with pressure, huh?
Yeah.
With pressure.
Yeah.
Okay, here. Is there any pain?
No, not really.
Okay, here,
No, it's okay.
here.
A little.
Okay. So that tenderness is little reduced.
Yeah.
Okay. But still you have.
Yeah.
See this.
Yeah.
Can you feel this?
Yeah.
So basically this is soft tissue structure, lumbar ligament. Okay. And tell me about this side. Is there any pain
No, not
with
at all.
pressure?
No.
So that means this side is okay.
Yeah.
So with sitting posture, that upper body weight
Yeah.
is more concentrating on this SI joint.
Yeah.
Okay, that's why your iliolumbar ligament is hurted.
Mm.
Okay. Yeah, can you turn?
Which
Face
way?
up, face up. Lie down.
Cushion?
Breathe in and out. Yes, exhale through your mouth because that is life. Yeah?
Yeah.
Now, put your both hands back side of neck and close this. Bend your both knees. Right. Come up, go down, come up, go down, come up, go down. Yeah. Yes. Relax. Breathe in and out. Okay. Turn this way. Make it straight this one. Just relax. Relax your shoulder. So is there any pain over sacrum here? No
No.
pain? Okay. Just make it loose. Yeah. That's it. Turn opposite. Maybe straight this one. Breathe in and out. Can you go little bit up? Little up. Yes. Now that's it. Just make it lose yourself. Turn one side, get up and walk. Just walk few steps. And look up. How you feel? You're loosen?
Yeah.
Loosen up?
I always feel looser after.
Just lie down, head this side, face up. Is there any pain here?
No.
No pain?
I'm normally quite stiff around
Yeah.
the neck and shoulders.
Because this upper calf is a little tight.
I don't know, it's, yeah.
This one. Yes, especially this one. Okay, this one. So now I'll correct your this discomfort. Okay. Is there any pain here?
No.
No pain? Okay. Just relax your neck. Just make it loose. Just make it loose. Don't make it tight. Okay. And don't worry. Yeah. Relax. Now little lesser.
Mm.
Little bit.
Yeah, a little bit. That's
turn one side, get up and walk again.
Feel lightheaded.
More relaxed.
Yeah.
Okay, can rotate your neck towards right and towards left.
I've got a little bit of
This range of motion is better now.
Yeah, it's, normally I'm really stiff.
Yeah, so see, most of the people are having with your posture, like you have forward-headed posture.
Yeah.
Okay, so forward-headed posture along with little bit rounded shoulder. So that's why this is the indication for tightness in the upper traps.
Yeah.
Simple. Along with that, your nature, like your body attitude, your neck is generally bending towards one side, like
Right.
always towards that right side more.
Oh, really?
Yes, it
Okay.
is. It is. Just because of your posture. So your shoulder is, that bending towards this side, but your neck is compensating.
Right, okay.
Okay, just neck is compensating. Okay.
Okay.
So just take care of that.
I spend most of my life like on my lap.
So yes. So like whenever you are going for like for setups and all, like your work station. So that should, your table that should nearer to your chair.
Yeah.
One thing, your elbow should be supported,
Mm-hmm.
and your eye level screen that should be the eye level.
Yeah.
If the screen is like downside,
Yeah.
okay, so you will be like this,
Mhm.
either you will be like this, okay. And if your elbow is not supported, then slouch.
Yeah.
The initial problem is like this, slouch.
Yeah.
So this will create rounded shoulder as well as forward-headed posture.
And I probably spend like 9-10 hours a day like that. Yeah.
Okay, just take care of that. Lie down again.
Face down.
Head this side, face up.
Face.
Face up. So now I'm going to release your iliopsoas, reflexors.
Okay.
Okay. Yeah, good. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. Breathe in and out. Good. Repeat it again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. Breathe in and out. Okay. Just turn that side. So why I'm releasing only right side? Because the problem is in more right side.
Yeah.
So now just bend your knee, lift and very straight. Same. Repeat it. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. Breathe in and out. So basically this muscle name is QL. Okay?
Yeah.
Quadratus lumbar. Yeah. Do it again. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Relax. Breathe in and out. Breathe in and out. And what about your stomach? Stomach is okay?
Yes,
No constipation, acidity and all? Great, great, great. Just turn, get up and sit. So now I'll get to your rounded shoulder. Okay?
Yeah.
So first, see the slouch. Okay?
Yeah.
We need to sit straight. So we need to practice this. Just go in
That's
this
very
way.
difficult.
Yes. Okay. Put your both hands on your waist like this. Okay? So what you will do, just push your elbow back.
Right.
I'll tell you, back side. Okay. Yeah, it's good. Amplify. Yeah. Push your elbow back. Push. Push. That's it. Sit straight first. Yes. And push your elbow back. That's it.
Oh, that's fine.
So the problem is why this side is not happening, because you are applying force with this posture. Whenever you will come in the correct posture and you apply the force, then your shoulder will correct.
Right, I see.
Okay. Just get
Kind
up.
of slouching.
Yes, just that. Walk. Then walk. Just it. The question is same, like how much relief you have out of pain. 10 is maximum pain.
That's
zero-
this one I
zero is
came in
nothing.
here, the school setting right now. Aches a little, but it's not painful.
Okay, so pain is not there, but still discomfort is there.
Yes, just a dull ache.
Okay, so first, see, that tell me about that pain. That pain is traveling down on the first day.
Yeah, I was going through like my bum, my thigh.
Yeah.
I could only make small steps walking because if I took the two longer strides, when this leg went behind me, it was
Okay, okay.
pain was traveling.
So you are doing walk. You are doing walk right now.
Walking's fine.
Okay. Walk is okay.
Yeah.
There's no discomfort, no pain as such.
No.
Okay. So now the tenderness is on right SI joint. Okay.
Yeah.
That soft tissue structure.
Mm.
Whenever we are pressing that structure,
Yeah.
then you are feeling pain.
Mm.
Okay. And generally in the movements like twisting and rotating, you have pain.
Yeah.
Nothing else.
Yeah.
Okay. So that means we can say it's 50% is better.
Yes.
Okay.
Yeah.
Okay, fine. Just lie down, face down. So with all your ADLs, okay, that this tape will help you to support your joints.
Yes.
That will prevent you further strain or damage. Okay. So just we'll remove this tomorrow. Either you can remove before bath or during bath also.
Yeah.
Okay.
This morning I took it off in
Yeah.
the shower.
Because your skin is also sensitive. So
It's getting irritated there, isn't it?
So you can remove this. You
Yeah.
can remove after bath or before bath.
Yeah.
It's up to you. Okay. Remove this. Still, that your this area is not in the stage of exercise. Exercise means only weight bearing exercise.
Yeah.
You can do
Yeah.
walk, and that will create partial weight bear, and then you do brisk walk. You
Yeah.
can do that, both the things. And during walk, your posture should be correct. It should not
Yeah.
like you. If you will sit down and walk, then again that will create pressure over that soft
Yeah.
tissue.
Yeah.
Just take care of that.
I'm moving house on Monday.
Yeah, because
I won't lift anything.
generally you're walking with the slouch posture.
Yeah.
Done.
Good. Thank you.
Yeah.